So my name is Sasha Wallace Sankersing. I'm the Biorisk and now CariPHLN manager at the Caribbean Public Health Agency, and a very warm welcome to everyone who has joined us today for our third session in our webinar series. And we will be focusing today on the WHO LBM4's monograph, specifically on biosafety program management and outbreak preparedness and resilience. And how timely is that? We hope that you will not only learn from our presenters, but that it would really be an opportunity to share some of the experiences that we've all had over these last few years, in fact. And to see how the new LBM4 is going to shape moving forward our programs as well. So very quickly, looking at the agenda for two presenters. First, we have Mr. David Bressler, who will be presenting on biosafety program management, followed by Ms. Amanda Baelish as well. And as you know, we do welcome your questions and comments. Please do use the question and answer box for specific questions so that we can ensure panelists have an opportunity to view those questions and provide the answers either at the end of the presentation or at the Q&A segment at the end. We do also have on hand with us today Dr. Cass Kojima from WHO, along with the team, Catherine Mackison-Booth and Rika Zinski, who together with our CDC colleagues here, and Dr. Christina Shield, who has been very instrumental in helping to get our speakers to be part of this series, all on hand to share their knowledge and experience with us as well. So we welcome all your questions and also comments and experience sharing. And I do want to acknowledge my dear friend Giselle Guevara from the CDC CRO office out of Barbados, Gleason, operating out of Jamaica, who's making this webinar possible. And of course, my colleagues at CARPHA, who are all joined today, listening in as participants, but also Feriel and Simone, who've been instrumental in helping me organize this. So at this time, I would like to welcome our first speaker, who has been a gentleman that over the years that we have known each other, we have try to see how we can actually work together. And so now it's an opportunity, the opportunity has finally arisen. Mr. David Bressler. And David has been working with CDC for many years now, since 1995, after he began his career at the US Army Medical Research Institute of Infectious Diseases at Fort Detrick. And some of us know about Fort Detrick either through science or through the movies about things that happened there. So David would be a very interesting person to speak to outside of the webinar as well. And David's research has involved studying the diagnostics and pathology of viral hemorrhagic fevers. He's participated in several outbreak response activities for Ebola, and he has also supervised activities and training of personnel in what we know as the maximum containment BSL-4 laboratories. And more recently, David has been working with the CDC Division of Global HIV and TB in the International Laboratory Branch, where he manages biosafety and laboratory strengthening efforts across Africa. David is also a certified certified biological safety professional, a CBSP, and a member of the American Biological Safety Association. And as we know, David brings a lot of experience, wealth of experience in his talk with us, but today he's going to be talking specifically about biosafety program management. So this time I will help David to share his screen. Okay, one moment. Let's get this on the way. I'm just trying to get my the bar as well, David. What has happened here is that my bar has gone a little bit different. Great. So I think we should be seeing my screen in full screen mode, and I will be checking the chat to make sure that persons are seeing it clearly. David, over to you.
Well, thank you, Sasha, and I apologize to everybody for the technical difficulties, but I think with Sasha in charge of moving the slides, I think we'll do just fine. So thank you for everybody in attendance. Thank you, Sasha. Good morning, good afternoon, and I guess we may even have some folks in the audience that it's early evening already. So welcome, everybody. As Sasha mentioned, I am David Bressler, and I am the Biosafety Manager for the International Laboratory branch here at CDC in Atlanta. A little bit more background would be probably helpful. I've been a microbiologist who's been in the field of virology for the past 32 years, and as Sasha mentioned, worked mainly with viral hemorrhagic fevers, Ebola, Lassa, Congo, Crimean hemorrhagic fever. I spent much of that time working and managing the safety for high and maximum containment laboratories here at CDC, as well as in the U.S. Department of Defense. I've worked internationally many of those years on outbreaks, and as well as training biosafety issues worldwide. And over the past 10 years here in ILB, I've supported the domestic and as well as the international operation of our laboratories dealing with HIV and TB diagnostics, testing, and platform validation. That's really what we do here in ILB. Currently, I oversee the safety and biosafety management of 7 independent and unique biosafety level 2 and 3 laboratories housed across 3 different laboratory buildings here at CDC campus. And so I guess with that introduction, let's begin our discussion of biosafety program management, really from the perspective of the new WHO Laboratory Biosafety Manual and obviously the new monograph. Next slide, please. So what we'll attempt to cover in this presentation is the biosafety program management from the monograph and how it relates to the overall WHO Laboratory Biosafety Manual. We'll look at the definition of biosafety program management, and we will discuss the management cycle and how to apply it, as well as talk about biosafety culture and/or the culture of biosafety, however you want to say that. We'll talk about roles and responsibilities, as well as, most importantly, how to develop and manage a biosafety program and what the basics to a good program are, really the fundamental elements and key considerations. We'll discuss the annexes that are included with the monograph, and we'll try to have a quick summary of the discussion before we close out the session. Next slide. So how do we use the monograph? What is the monograph? The WHO Laboratory Biosafety Manual, 4th edition, was released very recently, back in December of 2020. And really the LBM serves as the de facto global standard presenting best practices and guidance for biosafety. It really is the core document that presents basic and the overarching concepts of biosafety and handling biological materials. In addition to the new Laboratory Biosafety Manual, there are 7 subject-specific documents or monographs that accompany it, and these give much more detailed information on the basics of biosafety. They cover things like risk assessment, laboratory design and maintenance, personal protective equipment, biosafety cabinets and primary containment, and of course, a topic near and dear to our hearts, biosafety program management. Next slide. So how is a biosafety program defined in the monograph? Well, first of all, it's a collection of information and really those associated actions that includes institutional policies that cover scope, purpose, and objectives, a well-defined terminology or glossary, if you will, clearly defined roles and responsibilities for the personnel within the organization that we're talking about, and obviously a manual that deals with biosafety, really outlining risk control measures associated with those materials that are being handled at the facility, and obviously comprehensive procedures that support the overall safety policy. Some people would ask the question, how big or complex should my biosafety program be? I think as in so many questions having to do with biosafety, the answer is it depends. But it's really going to depend on things that you know about. It's going to depend on what your organization is, what it does with the organisms, you know, and you modify and mitigate the strategies or the biosafety issues with strategies that are given. And so, for example, one small diagnostic laboratory that deals only in small volumes of well-characterized blood samples, for example, probably would not need the same expansive program that a university or a government infectious disease research laboratory would need to have. And so these are the things that we'll talk about as we go along. Next slide. So to narrow things down and get to the real specifics, biosafety program management is the development, implementation, and oversight of biosafety at the organizational level, using a variety of information, including institutional policies, guidance documents, and practices and procedures, planning documents that cover how you're going to train and recruit personnel and how you're going to deal with incidents and emergency response. And obviously something that's very important are record keeping for not only personnel, but also the agents that you're dealing with and how you're going to deal with incidents that occur. And overall, I believe that the intent is to protect from exposure to harmful biological agents. But I would go probably even beyond that in saying that program management is there to protect the laboratorian and their colleagues in the laboratory, their families and their communities as a whole, as well as their place of employment, really and they do this by understanding and properly mitigating the biological risks that you would see at that facility. And that means utilizing all of the items that we just mentioned above to assist in doing that. Next slide. So effective proactive management is really essential to ensuring that the program objectives are going to be able to be thought out and determined and then continue to be met. And this is encompassed in the biosafety program management cycle. This is a 4-step management process for continual improvement of the entire biosafety program. And it includes 4 steps. The planning step includes developing the institutional program and biosafety policies with utilizing personnel that are knowledgeable, specifically a biosafety officer or a biosafety professional, along with a biosafety committee. Step 2 includes the assessment of the entire situation at your facility, which means doing biosafety risk assessments and biosecurity risk assessments, gap analyses, and things like that in order to get a complete picture. And then you move on to the really complex step, which is implementation, step 3. And that starts with things like developing your laboratory-specific biosafety manual. Includes biosecurity plans, training plans, development of standard operating procedures and good work practices, Things that you're going to look at include waste management and emergency response, and as well as what we talked about earlier, documentation and records keeping. You can see that the implementation step is really fairly comprehensive. And then what you get to is the final step, but this is really a cycle that keeps on going. And so what you want to do is make sure that you're continually reviewing and trying to improve your program using this cycle. So review and improvement includes evaluating how the processes that you put into place are working and if they can be improved. And obviously, if you have problems, then you want to go back and really determine where the problem occurred and how you can improve on that. This is what is referred to as the biosafety program management cycle. Next slide. So we hear a lot about the biosafety culture of an organization, or as I mentioned earlier, the organization culture of biosafety. Biosafety culture truly is critical. A good biosafety culture at your organization is critical for the success of the entire biosafety program. And overall, I would say that a good biosafety culture is one in which everyone, meaning management, workers, the entire corporate authority, all truly buy in to the idea that safety is just as important as the work being done by the organization. And it is safety, that is considered on a daily basis and incorporated into everything that is done. This requires commitment, obviously, from everyone, and it doesn't happen overnight. It requires time and requires that everyone trusts and respects everyone else to do what is right. Next slide. So best practices for culture of biosafety, as we mentioned earlier, senior management, you want to make sure that everyone is involved. So senior management has a huge part in this. Senior management and the entire corporate structure needs to be seen as being actively engaged in the safety process for everyone's benefit. Commitment of senior management is essential to building a strong biosafety culture and demonstrates to everyone that this is an important thing. The ways that this is demonstrated and can be seen across the organization is by having active and visible participation in biosafety related activities. That includes being part of biosafety meetings, and there should be management representation on the Institutional Biosafety Committee. One of the most important aspects of this is the assurance of financial and human resources. And as we all know, safety is not cheap, and that really brings this home. Really, it's something that needs to be done, but it requires resources. This all has to occur in an open and transparent environment, and everyone needs to be able to have their concerns heard and acted upon without any fear of reprisal. Next slide. So to continue, as I mentioned, this is across the entire organization. So now we look at the laboratory and the support personnel, lab leaders, biosafety professionals, and Institutional Biosafety Committee should all be working with and consulting with the laboratory and support staff to determine issues or concerns and things like that. It's their responsibility to provide encouragement and support and regularly engage in communication and open dialogue. And I like to think of this as something I try to incorporate into my program, and that's program management by walking around, making sure that I'm visible, making sure that I know the people that are working in my laboratory, knowing the new personnel, and just being able to walk into the laboratory and ask questions and talk to the laboratorians and do that. And this is something that goes both ways. They see you as a professional wanting to take an interest in what they're doing, and that helps greatly in developing that culture of biosafety. Laboratory staff really need to see their safety leaders as engaged, easy to talk to, and supporting of the work they do. Safety leaders should be willing to take up the course of the safety concerns that are justified. So if somebody comes to you with a problem and you investigate and realize that it is a problem, and that safety leader needs to be able to go ahead and make the case on that laboratorian part. Next slide. So as for roles and responsibilities, again, senior managers and management are ultimately responsible for the safety of everyone at the facility. This means all personnel, full-time personnel, contractors, visitors to the organization. It means the safety of everyone there. On the flip side, protecting the health and safety of the public from risks means that they're also responsible for ensuring the safety of everyone else, meaning the community at large, everyone around that supports your operations. So it's really an all-encompassing issue for management. And I will just point out one of, like I said before, allocating sufficient funds and resources. A big resource that should be considered. It's not just funds or money. Another resource can be time, making sure that your safety personnel have the time that they need to actually do the work that they need to do. I think that that's an important resource, and sometimes it's overlooked. Next slide. Program management responsibilities continued. Really, senior management defines the roles and responsibility for biosafety of all personnel within the organization, and they really give the authority to those safety personnel and make sure that not only they're responsible for doing safety and committed to it, but they also give them the resources for making sure it can be done. They define the higher level safety components like incident and emergency response, organizational communication plans, and occupational safety and health plans. And they provide oversight really of the entire program. Next slide. So another active component should be the Biosafety Committee. A well-rounded committee should represent cross-section of the institutional expertise and reflects on the size and complexity of the organization. If you're a facility that incorporates animal models in your research, then it would be kind of important to ensure that you have at least one member on your Biosafety Committee that is a veterinarian. You know, things like that are important, making sure that you have the proper expertise to be able to think out issues and concerns. The committee should act as an independent review group, and there should be no conflicts of interest on the committee in any part of the decision making. They should be a transparent organization. So in my career, I spent 10 years as a community member of Emory University's Institutional Biosafety Committee. And as a community member, I would bring up things that the community may be concerned about as part of the research program that they were involved in. So and in addition to that, we would review accidents, incidents. We had a big part in the risk assessment procedures, and obviously risk assessments were reviewed by the Institutional Biosafety Committee and things like that. The dual use risks were reviewed, meaning research that could be utilized for bad things. And so that came up many times in our IBC Institutional Biosafety Committee discussions. So next slide. The Biosafety Officer, or maybe a more euphemistic term that you'll see used, is Biosafety Professional. This person should support the development, implementation, maintenance, and continuous improvement of the organization's safety program. Some of their program responsibilities would be that they need to be technically proficient in order to recognize the hazards of the work being performed by the organization. They would be able to go to management, senior management, and relate safety-related issues that may be occurring. They make sure that the risk assessments and authorizations for working in the organization are done and in place. Biosafety professionals should be able to train just as readily as that person is able to do an audit or an inspection. This is often something that gets lost on biosafety professionals, that they are not just there to come down and be used as a hammer for the program. They should also be able to be involved quite readily and willingly to be able to train personnel in the way things should be done. Next slide. The laboratory director and manager. This may be, in other terms, the laboratory team leader. And overall, they are responsible for implementing processes within the facility, complying with the organization's biosafety policies. They are not only responsible for getting the laboratory work done, but they are or should be intimately familiar with the safety aspects and policies of their laboratory. They work to make sure that there are adequate and timely resources available for safety. And they should be ensuring that their personnel know who the biosafety professional is and continue to work with those personnel to make sure that their laboratory is safely operated. Next slide. When we talk about laboratory personnel, this means all of the other personnel within that organization. This may be students, this may be volunteers coming in, visitors. They need to have a hand in supporting the biosafety program as well. And their main responsibility is to read, know, understand, and adhere to all the institutional safety policies. They need to complete all the training and follow the SOPs. They should be introduced to and know the biosafety officer or professional within the organization. As a biosafety professional, when you recognize a laboratorian who really takes an interest in safety and biosafety in their laboratory, those individuals need to be encouraged and supported as much as possible. They can be very helpful in alerting you to issues and safety concerns that even the laboratory manager may not be aware of. I think the safety ambassador or a safety champion or some other safety recognition is often a helpful incentive in getting personnel involved. Next slide. Obviously, there are others that need to be a part of the biosafety management program, and these may be security and maintenance personnel. Do not ever neglect your administrative personnel. And these may be personnel that are not directly involved in lab work, but may have sort of a tangential role, maybe in shipping, moving packages and things to the shipping and receiving personnel, that sort of thing. So their responsibility is really to complete training and understand and hopefully be able to identify potential hazards and be able to communicate those concerns to the biosafety professional. Safety issues do not just affect laboratorians. Admin personnel could be involved in office safety training, and that makes them feel part of the larger team if they know how they could be involved in safety related issues. So make sure you don't neglect them. Next slide. Okay, so what are some of the key topics and considerations for developing your biosafety program? Key considerations would be size, complexity, and scope of your facility. Again, this is going to be different depending on what your organization does. The availability of resources, and again, this is not just funding or money, but human capital and time, and I would say even knowledge are all resources. There should be considerations as far as the gaps and deficiencies in those resources, and that may need to be developed by doing gap analysis or SWOT analysis. And the last point is, should the program be part of the overarching health and safety program, or should it be standalone? So for example, if your laboratory is one of many similar functioning laboratories in the facility, you're probably going to be okay going with the overarching or corporate safety program. However, if your laboratory or facility deals with uncommon risks or hazards that the rest of the organization is separate from or unfamiliar with, then having a standalone safety program may make sense in your case. Next slide. So key considerations. And I think what this slide is saying is that no matter the size of your lab or the complexity of your facility, whether it be a small clinical laboratory or a large multifunction research facility, you'll still need to employ the same basic program management cycle of planning, assessment, implementation, and review and improvement. Next slide. So key considerations of the planning step. And if we look at this slide, we're looking at the key considerations on the left of the slide, as well as a definition or description in the center, and questions or things that you may need to check out to determine what level of sophistication you're at. So what are the questions that you, as a biosafety or a member of the safety committee or laboratorian or a laboratory team leader manager should be able to answer? So if we look at Biosafety Committee, what are the roles and responsibilities of the committee, and what expertise is required for members of that committee? We already sort of touched on that earlier about the veterinarian being involved. For the Biosafety Officer, does the laboratory organization have someone specifically identified to handle biosafety issues? Next slide. For step 2, the assessment, you're including biosafety and biosecurity risk assessment. Questions that you should be asking are, what type of laboratory activities are we doing? What biological agents are involved, and what are the specific characteristics of those agents? For biosecurity risk assessment, which biological agents do we have that would be considered to be valuable for someone wanting to utilize them for nefarious purposes? What risk strategies do we have in place for controlling access? Next slide. So here we get, next slide. Here we get to the considerations for the implementation step, which again is the most comprehensive. This includes having the biosafety manual, biosecurity plan, and having an occupational health program in place. You can see some of the questions that the monograph thinks is important to determine status of these considerations. So again, what these are key considerations of the program embodied in this management cycle with the attending questions that you can ask. And if you answer them honestly, I believe that they will give you an understanding of the overall status of your biosafety program. Next slide. We'll go down through a few more of these. Personnel management and training. One question, are there succession planning procedures in place? And this means that in case of personnel turnover, people are always retiring, moving to other jobs. So what do you have, what type of procedures in place to alleviate that situation? Work practices, are SOPs written in clear and understandable language? For facility design, laboratory equipment, what are procedures for commissioning and decommissioning facilities? We're going through that right now here at CDC. Are these procedures documented? So often things like this are a part of the organizational quality assurance or quality management processes, and you may find the information related to that in those situations. Next slide. So key considerations continued: decontamination, waste management, emergency and incident response, records, documentation, inventory control. And I would encourage you just to look at the questions that they're asking, because these are actually good questions that will help you determine what the status is for your own program management. Next slide. So we continue with review and improvement, step 4. Incident reporting and investigation. I would look at how are corrective actions implemented, and I would add how are they followed up on. Another for internal and external audits and inspections. We just got done doing that here at CDC in my laboratory. How often do you do your own internal audits, and what happens to the findings? Next slide. So with that, we come to the annexes that are included in the monograph. And really the annexes are templates. Well, this is the templates and tools section, really. And these are examples, I think, of documents that contain information and considerations for the different aspects of biosafety program management. These annexes can be modified and as they're needed to support your own unique management program. And again, every program is different, every program is unique, but certainly the templates that are given can be utilized to help develop your own program. Next slide. The list of annexes comes to 6 documents and template tools. And these include things like pathogen safety data sheet templates, biosafety risk assessment templates. They even include a biosafety manual template, emergency response, an inventory, and self-inspection checklists. So I would encourage you to look at those and maybe utilize them as a place to start for your own program. Next slide. So with that, I think a very quick summary is in order. We've looked at the WHO Laboratory Biosafety Manual as a starting point for the basics of biosafety program management, but we've also gone a little bit in depth and covered the specifics of biosafety program management utilizing the monograph. We've looked at the way that the biosafety management program is defined, the management cycle, which incorporates different core concepts and key considerations, as well as some of the ideas and questions you can ask to determine where you are and where you want to go with your own program. Next slide. Yes, the obligatory disclaimer slide. We can move on. I really do want to thank Sasha and CARPHA for the opportunity to do this presentation. I hope it wasn't too long. Cause and all of those involved. I see Marianne, all of those, Tony and Chris, all of those people who assisted and contributed to the material of this presentation. And thank you especially to Sasha. Thank you for your attention.
Thank you very, very much, David. Very well received. I think at this time we had one question. Oh, we're having, okay. We're saying just one question here. So there was a question asked about many resources being available for risk assessment, but is there a specific template for biosecurity assessment? And yes, when you showed the slide with the templates, I think it was Annex 3 according to your slide. I see Rika here answered Annex 5, but just for persons to know, when you go through this particular monographs, there are a number of annexes that you can look at the templates, and it doesn't only include for biosafety, which I think we're more familiar with. And now we're trying to expand, now that we understand more about biosafety, moving towards what are biosecurity risks. That's something that we need to also consider. And I'm glad you mentioned, David, dual use risks, which at a later opportunity we would like to explore as well, and how that fits into biosecurity management. So
yeah, I mean, the dual use issue is something that we haven't had to consider for very long. This is a subject that's come up probably within the last 10, 15 years or so, I'd say. And it just has to do with, what new research can bring out as far as the characteristics of biological agents. And I think that by giving that research and making it available could lead some, as I mentioned, nefarious individuals, and give them the idea that these organisms or the research that's being done could be utilized for nefarious purposes. And that is something that I think we probably all need to be aware of. Certainly those organizations that we deal with uncommon biological agents that people don't work with, but they seem to have a hazy understanding that these things could be bad and intentionally bad. But yes, it's a concern, and excuse me, it's a concern, and I think that recent subject literature can be looked at, and information gleaned as to some of the considerations that you should use in your own program to sort of prevent dual use issues, and sort of get a handle on what they are, and how to prevent nefarious use of your own work.
Right. Thanks for that, David. So there are a couple more questions coming in, so that's great. We're going to encourage you to do that. I'm going to ask Rika, there is a question by Cecilia asking about the biosafety officer can also be in charge of biosecurity, or is it better to have a biosecurity officer? So I'm going to ask Rika to answer that, but in my own, I think the first thing will be the first up, risk assessment of what your own lab needs are and risks are, and the complexity of that facility, whether you can have a single individual doing that, or maybe your needs are based on your risk assessment. When you do that, you may need multiple persons to form your team. Yes, and specifically look at biosecurity. So Rika, I will ask you to answer this question, and then we will save some of the other questions coming in for the end. Over to you, Rika.
Yes, thank you. I wanted to type in the answer, but I accidentally pressed another button. But yes, usually I think it's the biosecurity officer who also doing the biosecurity part. Maybe it depends on how much biosecurity issues you have in your institution, how big is it, and so on. But I think usually there's no extra biosecurity officer.
Thanks, Rika. Yes, and if we were to give the example of CARPHA, even though we might not be as complex as, let's say, CDC, we do have, while I have responsibility for the laboratory biosafety and biosecurity, I'm doing that both in one role there. But I have an additional support from our agency where we have a health safety security person that really acts as my counterpart agency-wide. That helps as well. And I think when David spoke about, building the culture, identifying champions, that's also going to be important as well. And persons might have particular interests. Okay, so we will answer the other questions at the end, if you don't mind. And we would, at this time, move on to our second presentation for today, which is going to be on outbreak preparedness and resilience. And David, thanks again so much. Really appreciate
my pleasure.
And we're going to hear from you during the Q&A segment at the end as well. Yeah, so thanks. So allow me to welcome Amanda, Miss Amanda Baelish. Amanda, welcome you to open your camera. Thanks. And Amanda has been a microbiologist and laboratory science advisor for the CDC since 2001. She was a bench scientist at the CDC Influenza Division for 15 years, working on the antigenic characterization and research for non-human influenza viruses. She supported and provided training for international laboratories to obtain the National Influenza Center designation. She's currently in the CDC's Center for Global Health, Division of Global Health Protection, where she supports laboratories in Central America, the Middle East, and North Africa region, and West Africa to strengthen laboratory capacities, biosafety and biosecurity, quality management, and outbreak response. She has a biosurveillance project in the GCC to provide One Health laboratory assessments and conduct workshops focusing on biosafety, biosecurity, and biosurveillance. And so we really welcome you, Amanda. Thank you for your time. I know you've had an early morning already, and we look forward to this very timely presentation on outbreak preparedness and resilience. I encourage the participants to listen and see what is in the document, the core documents as well, but also in terms of us sharing our experiences and asking questions that you may have had while working through this outbreak response, pandemic response that we're in. Over to you, Amanda, and welcome.
Thank you so much, Sasha, and thank you to everyone. I appreciate the opportunity to present this at this meeting. I really enjoyed David's talk, and I will go on to discuss outbreak response, outbreak preparedness and resilience. So the Laboratory Biosafety Manual, 4th edition, which David just mentioned recently came out, and the Outbreak and Preparedness and Resilience Monograph is a guidance document to promote outbreak preparedness. They're intended to complement any national regulation and oversight mechanisms that may be in place. And for outbreak response and resilience, emphasis on this monograph is the application of the risk and evidence-based approach to the planning, preparedness, and operation of the outbreak laboratory. Look at the risk associated with the highly infectious diseases, emphasize the need for effective measures to prevent, detect, respond to, and learn from the outbreaks. The monograph overall aims to guide laboratory managers and others involved in setting up outbreak laboratories and how to rapidly and effectively respond to the demands placed on them by the outbreak and establish safe ways of working. This monograph promotes a situational approach to laboratory biosafety, including risk and evidence-based practices, and to ensure practices are locally relevant, proportionate to needs, and sustainable. This effective control of biological risk is the cornerstone of laboratory biosafety. Next, I'll go through the stages of the outbreak, which are outlined in the monograph. Of course, there's the pre-outbreak stage, in which there are no cases, but you should have ongoing surveillance activities. The next is individual cases of diseases. It could be detected through surveillance systems. There'll be lower number of specimens, and it's important to be aware that an increase in the number of cases of a particular disease above the normal level can sometimes go unnoticed for some time, and that symptoms of diseases can begin with non-specific fever symptoms. Detection and identification of outbreaks can be very challenging, especially when background endemic diseases such as malaria or influenza are prevalent. In widespread disease, the spread of is to other communities, regions, and countries. there are a high number of specimens. And prioritization of the testing may be required. For an example, tests for patients and healthcare workers may be prioritized over the general public. And in outbreak control, the government and frontline healthcare workers and health officials need to work together to limit the spread of the disease and put in place preventative measures. The number of specimens received by laboratories are likely to remain high, but the proportion of positive specimens will decrease as the outbreak is brought under control. Last stage is post-outbreak. See no new cases. And an outbreak is normally declared over when 2 incubation periods of the disease have passed with no infections being detected. Once the outbreak is declared over, surveillance still needs to continue in order to detect any reemergence of disease. Surveillance is a very important aspect. This information regarding the risk assessments was previously presented in an earlier session. So I'm just going to briefly review the risk assessments as a very important element in outbreak response. So there's a standardized and structured way to go through the risk assessment. You want to gather the information, evaluation of risk, develop a risk control strategy, select and implement controls, and of course there is review. Risk assessment is essential to ensure the safety of personnel working in laboratories. It allows the risk of working with hazards to be evaluated and used to determine and implement a set of risk control measures to reduce those risks to an acceptable risk. So I want to gather the information. What biological agent is there? Type of laboratory work or the procedures being done in the laboratory. What type of equipment will be used in that laboratory? What type of laboratory facility? And there's different human factors that are involved, including the competency of the staff. Other factors vary among different countries. There could be legal, political, cultural, or even public perception implications. So we want to evaluate the risk. You want to look at how can an exposure occur? How could the biological agent be released from the laboratory? What is the likelihood of exposure or release? What would be the consequences of exposure or release? In outbreak situations, the risk to personnel could be higher compared with normal day-to-day work, as there will be a high frequency of positive specimens, and the work environment may be very stressful. Therefore, better primary engineering and procedural risk control measures may need to be in place to protect the personnel that are found in a routine laboratory. And we all know no work in laboratory is risk-free. We need to then develop a risk control strategy. Determine the following. What resources are available for risk control measures? Based on the available resources, what are the most appropriate risk control strategies? Are there enough resources to put in place and maintain risk measures? Are the strategies effective and sustainable throughout the outbreak and achievable in the local context? And the risk control measures could include primary containment devices such as PPE, disinfectants, devices or chemicals for the inactivation of biological agents, SOPs, good microbiological practice and procedure, special packaging, training of personnel, and others work on laboratory activities. Once the risk assessment has been completed, the required risk control measures defined, a gap analysis should be done to see what risk control measures already have in place and what further resources are needed to bring the risk to an acceptable risk. They want to select and implement your risk control measures using national and international regulation. And these measures need to comply with those, the measures put in place need to comply with those regulations. Are these efficient or additional control measures need to enhance efficacy? Enough resources, operation, maintenance, or additional resources needed? And they need to have personnel have been trained. We want to select and implement risk control measures. An assessment should be performed before the laboratory is operational. The residual risk identified after risk control measures have been implemented is acceptable. Anyone going into the laboratory must be informed of all risks. And this includes not only laboratory staff, but other staff that may go into the laboratory, including cleaning staff, and make sure they're properly trained. Want to review the risk and risk control measures. The risks are likely to change throughout an outbreak. Assessments will need to be conducted throughout the outbreak. And possible changes that can occur during an outbreak that you would need to conduct another assessment would be new tests are brought into the laboratory, new staff. Laboratory is moved, need larger space. Work hours are extended due to the high number of samples. Now we're going to talk about the facility design. First, I want to talk about mobile laboratories. And mobile labs are especially useful at the beginning of an outbreak, as they have potential to be quickly relocated with minimal external support. And there are two types of mobile laboratories. The first model, the laboratory equipment and consumables, are boxed up and transported and unpacked in such as a tent or a small building. The second type of laboratory is built into a shipping container or a lorry that can be driven to the outbreak. Mobile laboratories are equipped and validated in advance to perform diagnostic testing of different biological agents and are designed to operate as independently as possible. Laboratories in a building have advantages over mobile laboratories because there might be more space available for the equipment. The building will have water and power supplies, and then equipment can be easily moved or changed within a laboratory building. Outbreak laboratories should develop a close working relationship with the local healthcare workers, clinicians, non-governmental organizations, and government organizations involved, public health officials, and possibly also other local security forces. The laboratory equipment that is used to protect the laboratory personnel from the pathogen, it is called a primary containment. This can include anything from screw cap tubes, biological safety cabinets, glove boxes, or flexible film isolators. Simple strategies using primary containment that rely on engineering technology, such as an isolator, rather than human skills to provide protection are preferred because increased number of specimens and extended working days can lead to higher error rate. Okay, then we can talk about personnel competence and training. Laboratory risk control measures can be compromised by human error. Experienced, competent, well-trained, and safety-conscious laboratory personnel are essential to lower the potential risk of infection to personnel and to produce accurate results safely. Risk control measures with regard to infrastructure, protocols, and equipment in the outbreak laboratory may differ from what they're used to in their day-to-day work. The training program should include information, discussion, and practice so that laboratory personnel can acquire sufficient biosafety and quality knowledge, skills, and experience to allow them to deploy to an outbreak laboratory. In consideration for deployment, you should consider not only the laboratory leader, but technical experts IT experts, equipment experts, and the general laboratory personnel. The laboratory leader should take over responsibility for biosafety and biosecurity in the laboratory and the welfare of the team. And generally, they just won't have time to actually work at the bench, but to provide guidance and support to the laboratory staff. An induction plan is highly recommended to ensure all personnel receive all relevant information on their deployment, especially as situations are fluid during outbreak responses. And they may differ from those outlined in the information received during training. I think we've seen this through the COVID response. Personnel competence and training. Selection of workers for an outbreak laboratory is not only dependent on their technical ability, they also need to be good team players and have good mental health and resilience, and should be able to work flexibly and have good communication skills. Now let's talk about personal protective equipment. Residual hazards are engineering controls that have been implemented need to be assessed. PPE should be used as the last line of defense to supplement the other protection measures. PPE used for each task needs to be determined by risk assessment, taking into account the routes of infection for the pathogens being tested for, other pathogens that may be present in the specimens, and other hazards, even including chemicals. Standard laboratory PPE when handling disinfectants and infectious diseases should include a laboratory coat, gown, gloves of sufficient length to cover your cuffs or gown of your gown, eye protection when splash hazards are present, and it should be available at all stages of sample processing, from sample receipt all the way through extraction to testing. Different performance and application standards exist for procurement of PPE. You should make sure that the procurement of PPE has standards such as EN standards, kite mark. You want to make sure that your PPE is appropriate and good for the safety of the lab staff. And always check all PPE when it arrives to make sure that there's no issues with it. Another issue is temperature control within the laboratory. It might not be in place if laboratory structure is basic. Heat can cause an increased risk of heat stress for the staff and dehydration. You may need to limit the time wearing PPE. Another consideration is if it's a hot environment, sweat can degrade the PPE performance. These are things that must be taken into consideration. It's important to define how each piece of PPE will be made safe after use, either by disposal and incineration or disinfection and cleaning. And then, of course, before reusing, it's important to check the PPE is still protective. Now I'm going to go on to talk about the laboratory workflow. It would be good for the selection of diagnostic methods that it is harmonized across different laboratories, the types of tests and assays. And for the diagnostic test, given the limited diagnostic capacity of an outbreak laboratory and the biosafety measures needed, a diagnostic algorithm needs to be established so that disease in question can be ruled in or out with high reliability. Direct pathogen detection. The accuracy of testing is, of course, important, but it's never 100%. Selection of the most appropriate diagnostic method may require a trade-off between sensitivity and specificity, but must also consider more practical considerations, such as supply sustainability, ease of use, practicality, and reproducibility. The choice of diagnostic methods and assays should be also guided by biosafety in the outbreak laboratory. While this might not be related to biosafety, results from the independent and ideally multi-center validation of the diagnostic test, such as accuracy, results from laboratory verification, outbreak diagnostic laboratory, approval of the test by international and national bodies, such as the US FDA or WHO, and the suitability of the test for a specific infectious stage of the patient. So in essence, the selection of the test should be validated and be appropriate for whatever stage of the infection. With serology testing, it is important to note that it should be done under the appropriate biosafety conditions. And it is important to follow the manufacturer's recommendations for the sample types. Point of care testing, the analyzers and point of care tests can eliminate some of the disadvantages of more complex laboratory testing by avoiding time-consuming specimen transport, patient travel to the laboratory. Healthcare workers already are wearing the appropriate PPE and can perform these tests on the ward. An important consideration, of course, is decontamination and waste management. A policy must be in place for each laboratory, which details how equipment, consumables, and laboratory waste are decontaminated after use. And risk assessment considers these pathogens. Broad-acting disinfecting chlorine solutions are often available and effective, and the care should be taken to use only fresh, active, and clean preparations at appropriate concentrations. Waste management, laboratory waste must be segregated, treated, and packaged so it leaves the laboratory in a safe condition for final disposal. All waste should be treated within the laboratory to make it non-infectious or should be processed close to the laboratory to avoid transporting high-risk infectious waste. And there are a range of methods that can use to inactivate pathogens, such as fumigation, autoclaving, incineration. Many of the methods might not be available in an outbreak laboratory, but in most outbreak settings with limited resources, the methods available for disinfection, followed by incineration in an off-site constructed incinerator or burning in a burn pit. If using sharps, it's not recommended, but use a sharps container or a plastic bottle to dispose of the sharps. Add a disinfectant to the container, and then it should be incinerated at a high temperature. Once incinerated, either an incinerator or a burn pit, then it should be buried just for safety. If, for some reason, the waste cannot be treated within the laboratory and then incinerated, but instead needs transporting to another facility, then the waste containing highly pathogenic agents falls into the transport category for UN 2814, infectious substances affecting humans, should be triple packaged for storage and transport to the final disposition site. Another important aspect is the storage of the specimens. It is important to store all specimens at the appropriate temperatures according to the pathogen that you're working with, whether it's refrigeration or at freezers at -20 or below. So it's important to make sure that storage is properly done for accurate testing and for further testing down the road. Once specimens are stored, freezers and refrigerators, they should be locked and supervised. And an inventory control should be taken of all those specimens in those freezers and refrigerators. Finally, reporting. Of course, we want to do this as soon as possible. And you do want to make sure that your reporting is based on a validated test results.
Hi, Amanda.
Yes.
Sasha here. Just before you go on, there's a bit of a background noise when you're speaking. We didn't hear that earlier. I'm not sure what is causing it. There's a bit of a slight echo or background noise during your speech. I don't know if maybe you can just, let's see if that will help to eliminate that echo.
Is this better?
Oh, it's much better. Let's try with that. Just say,
Okay.
there's still, I'm not sure, something is shaking in the background in the room, that's coming across. I'm not sure.
Okay. Hold on one second.
Okay.
Okay. Is that a little bit better?
Yes, it is. It is better. Thank you, Amanda.
I'm sorry about that. It was my ceiling fan.
Oh, okay, no problem. Thank you.
Okay. I'm just going to briefly mention about specimen transfer and transport. Just want to make sure that you are transporting these, if sending these to another laboratory, that you're properly packaging the samples. And of course, using triple packaging and following all safety guidelines with the packaging. Next, we're going to talk about accidents and human factors. Accident and incident response. It's important to train all employees on what they should do in the event of an accident. They need to be awareness of emergencies and how to respond appropriately to them. This means to call for help, which must be available, and emergency telephone numbers must be kept up to date and accessible to all personnel. They should be properly trained on how to properly care for spills within the laboratory. And the first priority is, of course, is to reduce exposure to the pathogens to those in the laboratory. They may require leaving the accident site and safe removal of containment of PPE and cordoning off the area. All incidents within the laboratory should be reported immediately. And the human factors we need to take into account is the interaction of laboratory personnel with their environment, their behavior, their performance, and the consequences of their actions are all a part of human factors. Apart from short-term consequences on worker performance, prolonged exposure to stressors may lead to negative and sometimes pathological reactions in individual team members. It is important for laboratory supervisors as well as their coworkers to work together to see that, ensure that people are not having too much stress, and this will affect the staff as well as everyone around them and even the results of the task. A safe work environment should be available to all personnel. There should be protective measures in place, and it is good to have health checks pre, during, and post deployments. Regarding laboratory biosecurity, the secure storage of specimens containing highly virulent biological agents is of prime importance, both during an outbreak and once it has been declared over, to prevent the loss, intentional release, theft, misuse, and proliferation of biological agents. And as David said earlier, we want to keep the pathogen safe from nefarious individuals. Limited access to laboratory and specimens. You want to make sure you have an accurate inventory of all specimens stored. Ensure that all personnel are trained on biosafety procedures. And there should be, you also want to make sure that patient data that you've collected is secured with limited access. Now we're at the point with declaring an outbreak over. Measures to contain the infectious disease outbreak or epidemic will lead to a decline in the number of cases of the disease and eventually to the end of the outbreak. A decline will also occur as a natural course of the infectious disease because, for example, the population has become mostly immune. This will likely be reflected by a decline in positive results found by the laboratories. Depending on the case definition applied for the disease, the laboratory capacity will still be required to test many specimens, as active surveillance measures will still need to be in place for a defined time, even after the last cases of disease have appeared. And once again, I want to thank everyone. And here's our obligatory disclaimer. And of course, acknowledgements to everyone that helped develop this monograph. It's an excellent guide for outbreak response and resilience. Thank you.
Thank you very much, Amanda. Thank you for taking us through that. And I'm really happy that, you know, the monograph and you included that bit on the use of the biological inventory. What happens to the samples afterwards? I think we look forward to that guidance and even some templates. I think it's one of the things that tends to get away from us. And we sometimes don't know what's happening in our freezers. And, you know, if it's left up to us laboratorians, we'd keep everything with the hope in mind that we will be doing research in the future, right? But doesn't always play out. And, you know, how long should we be keeping some of these samples, and how many of them? You keep every single one, you keep all positives, all negatives, you know, especially as we go through the phases of an outbreak. And secondly, you know, in terms of the critical aspect of the human element of ensuring that we are prioritizing that. And we're going to look at the question and answer boxes if we've had any questions. But I had a particular question surrounding that. You know, we talk about outbreak response and pre-deployment and identifying persons with certain characteristics. Many of us have been sort of all been in outbreak response now, right? Whether or not we were trained for it or prepared for it. And, you know, I wanted to ask you guys in the panel, what were some of the considerations, you know, that we really should try coming out of this to ensure the mental health, psychological aspect of our staff, you know, that we should be considering. I think everyone is sort of burnt out and we've been trying to put mechanisms in place to try to alleviate the stress of working now, you know, almost 18 months into the pandemic response. But what will be some of the considerations that we can put in place to sort of structure it a little bit so that we're not doing the same thing again the next time something like this happens? Over. I leave that to either Amanda, David, or any of the other colleagues on the panel, if you have anything to say to that.
Hi, this is Amanda. Yes, it is important for the overall well-being of the staff. And yes, COVID is an example. This has been a long response. It's important for laboratory leadership to really take stock, work with their staff. How are they feeling? You know, how are they stressed? It's also affecting their families. Many are having to go to different sites so they're away from their family. There should be some type of mental health support for the staff. Give them a break. You know, we all need a break every once in a while. Just to regroup and actually, you know, get your mental health in order, and can also affect your physical health as well. I refer to others to provide additional information.
Thanks, Amanda.
Hi,
Chris?
this is Chris. Yeah, I just wanted to say that Amanda has been working on the COVID response almost continuously since it began, as well as doing her other work, and has been able to maintain a pretty, a very, how could I say, I'm kind of amazed at her ability to, keep her cool. She has taken little breaks, but I think I'm glad you responded to that, Amanda, because, I know at the very beginning of the response when I served, it was extremely stressful, particularly in the first month. And there weren't very many people working it. And that is usually how it begins, that it is very understaffed. People don't know what's going on. There's a lot of moving parts. You learn something new every day. And, I think that's really important for people to be aware of and to watch your staff. And, I think it'll be pretty apparent who's stressed out, who's not. But you're talking to Amanda Balish, who is maintains her cool very well. So I think she knows this, and she's worked many outbreak responses in the past. So there you go.
Thanks very much, Chris. And what a testimony to your support, Amanda, to the response. So thank you.